So hello everyone, welcome to our new webinar. Today we are going to talk about a very interesting topic, and we are trying to unravel the gut-brain connection. Hopefully by the end of this webinar we will find out more about this interesting new topic. And we will wait a couple of seconds just for everyone to gather, and then we will start with a short introduction about our Young ESPGHAN committee and their mission. And then we will dig into this presentation. My name is Mara Ionescu, and I will be your moderator today. Okay, so I guess we can start. As I said, my name is Mara Ionescu, and I'm one of the Young ESPGHAN committee members. I don't know why it's not working. Okay, sorry. So it was a bit difficult to start the presentation. So as I said, I'm a member of the Young ESPGHAN committee, and our aim is to promote high quality research and training, and to organize different activities for our young members, and also most important to represent their interest in the council and the society. Some of our educational events gather the Young ESPGHAN Mentorship Program, which now has several editions, and it's a forum to meet and receive support from more senior ESPGHAN members. So I really invite you to join the next year edition. And I would like to mention that this year we had 12 pairs, and they had also the opportunity to meet in person in Helsinki. Also, we had a very great day, a very great Young ESPGHAN Day during our annual conference in Helsinki. And we had the opportunity to decode research, to learn more about systematic reviews, about meta-analysis and peer review essentials. And also we had a great workshop, and we had the opportunity to be a reviewer. Also, we ended our special Young Day with a session with immersive painting, and as a proof, we have here some pictures from our immersive painting, which was absolutely great. Also, during this year conference, we had a new session which was entitled Expert Dialogues, Navigating Clinical Cases for Young Professionals. And young people like us had the opportunity to discuss with experts in the field and learn more about their most interesting but also most difficult cases they encountered during their activity, their clinical activity. Also, during every year, we have our Meet the President event. This year, we had both our current president, and it was a very interesting and fruitful meeting. I would like also to mention our upcoming educational events. You can also enter our website and to find out more about our ongoing and future events. I would like to mention that you can still register for the Eastern European Summer School, which is held in September, at the beginning of September. But also you can try to apply for an endoscopy training fellowship, and although maybe you will get rejected the first time, just keep trying, and in the end you will be successful. But who we are, who is our Young ESPGHAN committee? We are a group, a small family made of 11 members. We here have 8 of us, with Anne-Marie, who is our chair. And also we have Ana, Jose, Pinar, Petra, Francesca, who is also our social media guru, Vangelis, and myself, Mara. So I hope I convinced you. And if you're not a member yet, please join us. you will have many benefits, except besides our interesting events, you will also have multiple benefits, from subscription to GPGN online to access to all of the research grants and awards, and also the possibility to take part in so many educational events. So how to become a member? You can find an application form on our website, and with your CV and your letter of support from a full member not serving in the council, you can become one of our trainee members. You can find out more information about us and our mission on the ESGHAN app, and also on our social media. So you can follow us on Instagram if you want more information about our committee. And also, I would like to give some very important news that ESGHAN is going to organize an European certification. And I really encourage you, once this is organized, to apply and to obtain this European certification that is going to be very valuable for all of us. Also, I would like to invite you to our next webinars. We are going to have a webinar in July and also in August regarding different topics on nutrition. So please join us. And without further ado, I would like to start today's webinar about the connection of the gut-brain and also the microbiome's role in disorders of the gut-brain interaction. So we will have together with us Professor Siobhain Mahony, who is a global leader in neurobiology and women's health with over 20 years of pioneering research on the gut microbiome's impact on brain function. And among the first to study the gut-brain axis, her work has reshaped understanding of stress-related disorder, especially regarding sex differences. And also, I would like to mention that she's one of my mentors, and I'm very thankful that I had the opportunity to work under her supervision. So, thank you for accepting our invitation.
Thanks, Mara, and congratulations. This is a fantastic event. You're super. You're doing so much amazing work. I'm delighted to be here and delighted to be with you as well. I must replace the current share. Is that okay if I continue with that? Okay, perfect. It was a really great overview of what you're doing, because I wouldn't have known before. And you're brand new. Are you brand new, or is this going for a few years?
So I am brand new in this committee. So I joined the committee 1 year ago. Wow. But the committee has a quite long history, let's say, for by now.
Excellent. No, it's great to see. It's super to see. Now, if I could get rid of this little bit down here, I just go to slide from the beginning. Do the slides look okay, Mara?
Perfect. Yes, it's perfect.
Okay, super. This bit will go in a minute, I'm sure. Oh, it's gone now. Excellent. So I'll time it a little bit, but please tell me if I'm going over time and stop me, okay? Whenever you need me to.
We have enough time, no problem.
Thank you so much. And thank you so much to Mara and the committee for inviting me to speak today. It's really my pleasure. I had such a great time with Mara in my lab. She's probably one of the hardest workers I've ever seen in my lab. So it's really a pleasure to do anything that she asks me to do. So it's great to be here today to talk about the role of the microbiome in health and disease, and really how it's associated with driving our well-being the majority of the time in well individuals, but also that how we've discovered how changes into the microbiome in our bowel is also linked to diseases as well. Now, we still have a long way to go. There's been a huge amount of research and money put into researching the microbiome, but we still need to, I suppose, figure out exactly what role it plays in health and disease. So just, I suppose, a little bit of background of where I've come from. So I did my PhD a long time ago now in APC Microbiome Ireland. So the APC is one of the, I'll just pop it over here. The APC is one of the, I suppose, most respected centres in the world when we talk about microbiome research. And what it does is really brings together people like researchers, clinicians, but also industry partners as well, to really develop microbiome knowledge. So really looking into and doing observational studies, doing anything from in vitro cell work, microbiology, immunology. We work with gastroenterologists, psychologists, psychiatrists, and so on, to really kind of develop solutions for microbiome associated diseases as well. So there's different themes within the APC as well. I won't go through them all, but really, I'm really involved in theme 3, which is the gut-brain module, the gut-brain microbiome axis. I'm also kind of dipping into diet and microbes a little bit, which we can't avoid, of course, as well. But we were one of the first in the world to develop this concept of how the bacteria within our bowel actually interact with our central nervous system. So the bacteria within our bowel, as we know, exists there. When we talk about the microbiome, it's actually all of the microorganisms, and I'll talk about that in a second, all the microorganisms. But when I talk through this actual presentation today, it's really the bacteria that I'm focusing on. But we were one of the first in the world to show that the microbiome, particularly the bacteria in the bowel and its metabolites, actually could interact indirectly with the central nervous system to affect well-being. There's been a number of different impacts over the last few years in APC as well, which we're extremely proud of. But for me, myself and the Mahony lab, I do both clinical and preclinical research. So I work on human studies, both observational and interventional. For many years, I've worked on pain, but I also work on how our microbiome within our bowel interacts with our central nervous system and stress as well. So some of the research goals that I do and I carry out within my research is looking at the effects of stress in early life, how that's associated with changing the microbiome and influencing our health and disease outcomes. I also, as I mentioned, worked a lot on pain, looking at different types of interventions pre-surgically, how we can reduce post-surgical pain. I'm really interested in how sex differences and hormones drive differences within our microbiota, within our bowel, and then, of course, drive differences with regard to brain-related disorders as well. And just some of the more female-specific disorders that I actually research as well around the microbiome include endometriosis and menopause. So the microbiome itself, I suppose, started many years ago, and it really kind of started off with the Human Microbiome Research Project, which started in the US in 2007. And this was an enormous study at the time, and it was kind of, I suppose, very new to the concept of the microbiome and new to the concept of research as well. So it was a well-funded study, but really a lot of amazing findings have come out of this study as well in time. Again, fueling some of our own research as well. But the gut microbiota really includes all these 100 trillion microbes that reside within our bowel. And we know they're extremely important for lots of different essential activities within our entire body, so not just our brain. I'm a neuroscientist, so I focus very much on the brain, but again, we can't forget the rest of the body that's in between the gut and the brain, of course. So a gut microbiota, which are all of the organisms, not even just the bacteria, but the microbiota within our bowel includes those 100 trillion bacteria. And those bacteria then are associated with really important functions such as vitamin production, our metabolism, hormone regulation, immunity, but also brain function as well. So it's estimated that the ratio of bacteria to human cells is about 1:1. It's a little bit greater now, actually, that the data has shown that's about 1:1.3, with more bacterial cells than human cells. And then the genes contained within the human microbiota, which is termed the microbiome. So the microbiome is actually the phrase associated with the functional capability, so the actual metabolites and genetic makeup of that bacterial population. That whole bacteria, or that whole genetic makeup, is assumed to be about 150-fold greater than those contained within the individual human genome, which is phenomenal when we think about it. Also important to think about as well is, I suppose, the beginnings of the microbiome and then how it changes through our lifespan. And then, as I've mentioned as well, I'm very much interested in the differences between the microbiome within our bowel and the sexes. So how hormones within our body actually drive differences between inner microbiota and vice versa as well. So when we're in utero, it's thought that it's a virtually sterile environment. Now, there have been some studies looking at the microbiome of the placenta, for example, or maybe some microbiome or bacteria are associated with some of the amniotic fluid, but there's still not an absolute definition or absolute belief that microbes are present before birth in utero. And some of my colleagues here in UCC would have kind of debunked and have written quite clearly about the concept of having no microbes before birth, but some studies have shown it, so I'll just say that there's controversy around it. It's not definitive yet. But I suppose in essence then and the simplest way to define it is that we're virtually born sterile. And there's two different ways to be born, of course, vaginally or via C-section. And then at the very start, we start to get colonized as babies. We start to get colonized from lots of different sources, of course. But what's really evident in early life is that we start to see differences. I don't know if you can see my cursor. I'll try and change it to... maybe it doesn't matter actually. Mara, can you see my cursor?
Yes, I can
Perfect.
see.
Just to point out a few little different things on the slides as well, because there's a lot maybe on some of these slides. So just even in early life, what we tend to see is that we do tend to see sex differences between the sexes, or differences in the microbiome between the sexes. And we know, of course, that the actual microbe, or the actual hormones between the sexes is not that different until we actually hit puberty. So the driving force behind the differences between males and females in very early life, so this is the very early stages of life, are not really known. But what we do know as well is that when we think about brain and health and I suppose associated early life adverse events and brain health in later life, we know that some early life events really affect baby boys a lot more. And we tend to see some of those brain disorders later in life affecting males at a higher proportion, such as autism or schizophrenia. And what we tend to see is more beneficial bacteria in the gut of the baby girl than we do of the boy. So we see higher levels of lactobacillus and bifidobacteria in the bowels of baby girls in very early life compared to those of baby boys. So potentially these early life probiotic species are lending themselves to ameliorating or reducing the impact of potential stressors in life on baby girls' gut and brain as well. We still don't know if this is definitive, but we do know there's differences in the sexes in the very early stages of life with regard to their microbiome. As we tend towards puberty, then of course we do see large fluctuations between our hormone levels, of course, and major differences between men and women as we always tend towards puberty. And of course, then in our reproductive years as well, we do see changes into hormones. And there have been some studies, not an enormous amount of studies now, looking at the differences linked between the hormones and the microbiota within our bowel and vice versa. But what we do know, what we clearly know, is that there is a bidirectional communication between our hormones, our gonadal hormones produced by our gonads and other parts of our body, such as our breasts and our bones as well, and the actual bacteria. And we know there's bacteria actually within our bowel that have receptors for hormones, because we know that a lot of the ways, or one of the major ways that we actually excrete hormones through our body or out of our body, is actually through our bowel. So therefore, the bacteria within our bowel are being exposed to these different types of hormones because they're being excreted through the bowel, meaning that the bacteria have a chance to interact with these hormones. And there is species of bacteria that are able to deconjugate some of these hormones. So instead of excreting them, they put them back into the body. And this is certain species or certain communities of bacteria. But then as we age, then we know that our hormones actually change over time, particularly in females. They don't change so much in men actually as men age, but in women they definitely change. And we know that over time that the ovaries actually shut down nearly completely a lot of the time, and we see a major decline in estrogen levels and progesterone levels in females. But it doesn't completely stop. We still have estrogen being produced by our breast tissue and also our bone tissue, and also adipose tissue as well in females. So there's still estrogen circulating around. But what we do tend to see differences in some of those studies in the microbiome and associated with hormones during reproductive years between men and women. What we tend to see when women age is that when their estrogen and progesterone levels decline, we tend to see that their microbiota is a lot more similar to men as they tend towards the postmenopausal phase of life. Now, I suppose one of the important things before we move on to the brain-gut axis is looking at the idea of programming the gut microbiome. So in our very early stages of life, I've mentioned that there probably isn't, and there's no definitive evidence to show there is a microbiome before conception and also in pregnancy as well. But what we do know is that in the preconception period and also during pregnancy, there are certain scenarios or factors such as mental health, for example, antibiotic exposure or drug exposure, and lifestyle factors as well, that actually affects the maternal microbiome in the preconception and also in the pregnancy period as well. So the maternal microbiome itself has a potential to influence the baby's microbiome at birth, but it also as well, because it maintains the well-being of the mother, has another chance to actually affect, I suppose, the development of the placenta, the development of all of the factors associated with the baby in utero as well. So just because the microbiome isn't evident and directly associated with the baby in utero, we do need to think about the microbiome, particularly the maternal microbiome, in the preconception phase and in the pregnancy phases as well. And of course, then at birth as well, I've mentioned there's 2 ways to be born, vaginally or C-section. And we know that, of course, different microbes are going to colonize the baby depending on which way you're born. And we do know that there are major differences between the bacteria within the bowel of babies born vaginally versus C-section up until about 3 years of age. And this is important as well when we think about the brain-gut axis, is because if these 2 organs are actually interacting with each other and allowing for one to actually influence each other, particularly in the early phases of life as well, we do need to be conscious of the actual programming, so the actual microbiota that are present in the bowel at those very important phases of brain development as well, which of course is in the very early stages of life. So therefore, if there's different microbes taking up residence in the bowel, because of even just one element, one factor being born in a different way, potentially there's going to be differences in brain health as children age then as well. And there have been studies looking at the differences between brain and brain function between C-section born babies and vaginally born babies as well. As the baby ages a little bit, of course, it has to be fed. And we know that there's also 2 ways to be fed as well, bottle feeding or breastfeeding, or then, of course, a combination of both. And we know, of course, that breastfeeding is the optimal way to actually, and the gold standard to actually feed a baby, but it's not always possible for a woman to do that. But again, we do know that there's differences between the bacteria within the bowel of the baby that is breastfed, again, versus the baby that is fully formula fed. And again, there is also changes looking at different studies as well, which I'll allude to later on. There's different studies showing that different cognitive function is developed a little bit differently between babies that are formula fed versus those that are born vaginally, or versus those that are breastfed as well. As children age, of course, there's going to be an introduction to solid food, which is absolutely necessary for health and growth to continue as well. But the timing of the introduction of solid food as well will determine which microbes take up residence. And of course, again, those dietary habits that are inbuilt in children in very early ages is really important for the laying down of those very important early bacteria within the bowel that we know assist with brain development as well. So this is one of the studies that was carried out a few years ago by the wonderful Maria Dominguez-Bello, and it really looked at, I suppose, the dynamics and the stabilization of the human gut microbiome during the first few years of life. And again, looking at concepts of the vaginally born baby, breastfed baby versus bottle-fed and C-section and so on. So what they did was really they looked at the gut microbiomes of 98 mothers and their infants during the first years of life. And again, what they noted was, and again, I mean, you could be looking at some, some of the studies that we look at as well would have thousands of people in it. And some reviewers of grants as well, so you should have thousands of individuals within these studies as well. It's not always possible. So actually a number of 98 is a fairly decent number of individuals in a study, especially when you're incorporating the child into it as well. So this is a really nicely laid out study and powered study as well. So really what we see is that the cessation of breastfeeding really drives the maturation of infant gut microbiome. And we really see that the shifts in the signature of certain species then demonstrate really non-random transitions in the infant gut. So changes in nutrients and xenobiotic metabolism really mark the maturation of gut microbiome as opposed to the other factors. So it's really the changing of the food, so getting the child onto solid food, but also potentially as well antibiotics or medications the child takes in early life changes the microbiome to what it will be as well maturing. So importantly as well for early life microbiome. In early life, it's an extremely dynamic environment within the bowel, as in some microbes take up residence, they leave again, there's some bloom, some change, some decrease, some increase. So we see this very dynamic shift in the very early phases of life. It's probably because the gut itself is actually developing as well. And also because as well, the immune system is developing, which also interacts with the gut and the microbes as well. But what we tend to see is that the gut bacteria actually matures over time. So therefore, what you want is, even though there's dynamic ability in the very early phases of life, you really want to influence the best potential or the best possible profile of bacteria to reside in that bowel in the maybe up to about 5 years of age, because this is the microbiome then that will continue with you throughout your life. So looking, I suppose, at different elements as well that interact with our microbiome, and we can't, of course, forget maternal nutrition. Thinking about the interaction of these 3 elements, it's not just the microbiome that's driving brain health and gut, but it's also the nutrition from both the maternal side, but also the infant side as well. So we know that we've mentioned the maternal microbiome and the different factors that affect the developing microbiome within the baby. From a nutrition point of view, we do need to consider the mother, what nutrition she takes in the preconception period, but also what nutrition she actually consumes during pregnancy is also important for driving the microbiome. Infant nutrition, we've mentioned it a little bit as well. The human milk is the best possible way to be fed, but there's a huge amount of research now into infant formula. And we know that some infant formula as well does contain now prebiotics and probiotics. So prebiotics includes those fructooligosaccharides and galactooligosaccharides, which really promote the growth of those probiotic species, including lactobacillus and bifidobacteria. And they really drive, I suppose, and lots of studies were carried out as early as 2004, looking at specific bifidobacteria species and how they actually drive the maturation of the stress element of the brain. So including even prebiotics and probiotics into infant formula is really important. It's still very beneficial for the development of the baby's microbiome, but also its brain as well. But both nutrition and the actual microbiome do feed into the epigenome as well, of course, which we can't, of course, avoid, because we know that the environment will shape both our brain health, but also our microbiota health as well. So looking, I suppose, a little bit at, how the microbiome is associated with childhood disease. And again, we know that the brain and the gut interact, but some of the diseases that are associated with brain health in the younger years as well, and can, of course, lead into these diseases being maintained in later life. But some of the diseases that are associated with brain health in childhood that have started to emerge at a very higher rate, definitely in Ireland now, than we would have seen before, are autism, of course, attention deficit hyperactivity disorder. But obesity as well, which we wouldn't have thought about as a central nervous system disorder before, is now starting to come into the fore as a chronic disorder, but that is associated with the microbiome and potentially associated with the nervous system as well. Nowadays, we are seeing children that are very much being diagnosed with depression and anxiety in very early years, as young as 7 or as 9. 7 to 9 year olds are now being diagnosed with depression and anxiety here in Ireland. And again, whilst medication, of course, is hugely beneficial and is absolutely necessary in some of these situations, but dietary intervention and potentially probiotic interventions for some of these brain disorders may be actually able to ameliorate and potentially actually reduce the need for pharmacological interventions as well. So targeting the microbiome and the gut potentially for childhood diseases might be something that we could look at as well. So I suppose looking at, and I know this text is quite small as well, but just maybe to look at the actual physics and the actual functioning of the microbiome gut-brain axis just by itself for a second as well. So the microbiome within our bowel is actually all of, I've mentioned, not just the bacteria. Sorry, this keeps popping up. There's probably little I can do about it when I use the cursor. But the microbiome within our bowel, as I've mentioned, is really important to actually lay down in very early life as well. But why that's important is because it produces all of the neurotransmitters that the central nervous system produces. It produces noradrenaline, it produces serotonin, acetylcholine, it produces GABA, glutamate. And it's not a coincidence that it produces all of the exact same neurotransmitters our central nervous system produces. It has this predisposed, I suppose, inbuilt survival mechanism to actually influence our well-being in our body, but also influence our central nervous system as well. So the three main axes of communication between the brain and the gut include your nervous system, which is your vagus nerve, which we know is a bidirectional communication pathway as well. So the vagus nerve, but also your immune system and also your hormonal system as well, which is your hypothalamic pituitary adrenal axis. So your hypothalamus and your pituitary, as you know, reside within the central nervous system. And then we also have our adrenal glands sitting on top of our kidneys. So psychological stress affects our brain health, of course, and turns on the hypothalamic pituitary adrenal axis to actually lead to the release of cortisol, which actually then, of course, affects the immune system, which can affect the actual the gut itself and the actual microbes, and also affect actually stress-related hormones such as cortisol also affect the gut barrier as well to make it a little bit more leaky, then affecting the actual different microbes within the bowel. And then, of course, we know that changes within the gut itself, such as antibiotic usage, which directly affects the bacteria within our bowel, gastrointestinal infections affect the bacteria within our bowel. So all of these, I suppose, localized effects or localized stresses within the bowel also affect the central nervous system as well, through either the central nervous system or through the nervous system, as we said, the vagus nerve, but also through the immune system as well. So the three main pathways, as I've mentioned, are the nervous system or the spinal cord, which is also part of your nervous system, interaction between the two, your immune system, and also your hormonal system, allowing for this bi-directional communication between the actual brain and the gut itself as well. So as I've mentioned, different phases and different elements in early life really drive the programming of the microbiome within the bowel itself, such as when you actually start or when you actually cease lactation, when you start solid food, as we saw from the other study, Marie Dominguez Bellows study as well, actually starting solid food really drives this huge maturation within the actual microbiome as well itself. So what's really important is to lay down a really healthy microbiome prior to the introduction of solid food. So either incorporating breastfeeding if possible, but again, if that's not possible, then to maybe incorporate those types of formulas that are built on a lot of research around breast milk composition, and incorporating prebiotics in early life, either through formula. And there's also actually probiotics and prebiotics for C-section born babies now as well. On the market as well. So if breast milk isn't possible, then of course there is other alternatives as well. But laying down that really good foundation of microbiome in early life prior to the introduction of solid food is really important for the maturation of the microbiome in the bowel, but also for the appropriate development of the central nervous system, because this interaction between the microbes and the brain doesn't just happen between us as adults, but it starts the moment the microbes start interacting or start colonizing the bowel, which is day one, which is postnatal day one, for example. So maybe looking at some early life components as well, and what's important in early life and affecting the microbiome to actually drive brain development. So we know, of course, that proper nutrition is crucial for normal brain development and growth. The first 1,000 days is most critical because we know, of course, as well, the first 1,000 days really incorporates pregnancy, preconception and pregnancy as well. So when I talk about dietary components being important in some of those first days, it's really maternal nutrition and maternal diet as well, which affects the maternal microbiome, which allows the placenta and the baby to grow appropriately, but also drives the maternal vaginal and gut microbiome as well, which do affect the actual baby. Either if the baby is born vaginally, will take up some of the mother's vaginal microbiome, but the gut actually microbiome of the mother does interact immunologically with the baby in utero as well. And then, of course, the following days as well, of course, mean that it's the diet of the baby that's important in very early life. So some of the really important nutrients for brain development in early life include lipids, minerals and vitamins and amino acids, of course. When we think about breast milk itself has some very important lipids, which include milk fat globule and membrane, which is protein, but it also includes phospholipids as well, which are part of this membrane as well. And this membrane, which we'll talk about in a second, is just the membrane that sits outside the actual fat globule. And it's really amazing. I've done some research on this actually in animal studies, and you can enrich, basically, I think you can actually get rid of the fat. I don't know the full process of how you actually enrich the component to actually get left with a lot of milk fat globule membrane, but there's a whole process you can actually deplete the actual fat from it and just be left with the actual membrane itself. And the membrane itself is a neuroactive, has been shown to have neuroactive components. So some also as well looking at, I suppose, there's also microbiota targeted supplemented infant formula as well, as I've mentioned, that contain pre and probiotics. But I suppose what's not fully, I suppose, integrated is the role of the microbiome and these nutrient interactions in very early life. So we know these nutrients are really important for brain health, but we don't know exactly how the microbiome allows these different diet components to have the best possible interaction with the brain, and how these three elements, the microbiome, diet and brain, actually interact in early life. But we do know there is some interaction between a microbiome and nutrient interactions, of course. We do need further research on that. Now, I suppose just looking at, again, I'm not an expert in autism spectrum disorder. They do look at ASD in our lab. And I suppose I've interacted with a few people that actually research this intricately as well. But we do know, of course, that there is some studies showing that in autism spectrum disorder, there may be an association between the microbiome and differences in the microbiome as well. Now, we know that there's a higher risk of autism spectrum disorder depending on some that are dependent hugely on genetic factors, and there's also some environmental factors as well, such as different in utero factors, such as infections and so on at different stages of pregnancy as well. Now, children with autism spectrum disorder, and again, from personal experience, my nephew has ASD, they tend to have this very restrictive feeding behavior. They tend to prefer maybe one type of food at different stages of life. It's very difficult in some children with ASD to actually introduce a very diverse food. So therefore, our diet. So therefore, if you don't have a diverse diet in early life, it's not possible to generate this diverse microbiome as well. And we know that diversity is preferable to be lower when you're a very young infant, but as you age, you want a higher microbiome diversity. And the way to achieve that is to add different foods and different fibers that will then feed these different microbes, so that you have this kind of bloom of a diverse community. So you have just lots of different microbes, which is difficult, of course, if you have restrictive feeding and a low food diversity. So what we do tend to see as well is that, of course, if we have a decreased microbiome diversity, then this will feed into the microbiome gut-brain axis and interact then, of course, with the central nervous system, potentially in any individual that has a decreased microbiome diversity as well. So what this means is, for any individual that has a decreased microbiome diversity, particularly when we think about brain interactions, we tend to see inflammation. We tend to see potentially inflammation in the systemic system, but also inflammation at the central nervous system. We tend to see decreases in the beneficial short-chain fatty acids, which leads to less of those neurotransmitters that we know are important for brain health and gut health. We see increased gut permeability and also a dysbiosis or suboptimal levels of the good bacteria. And all of these elements actually feed into the exacerbation of core symptoms of autism spectrum disorder, which include maybe sometimes anxiety, depression associated with this disorder, again, lack of sleep, or reduced sleeping patterns, which then, of course, feeds into different behavioral patterns that aren't positive for these individuals as well. Okay. So I'm not going to go through all of these studies at all, but there has been a substantial number of studies looking at different types of interventions for autism spectrum disorder. So targeting the bowel to actually ameliorate and to alleviate some of the symptoms that actually worry children or adults with autism spectrum disorder, and also their parents as well. So again, treatment with probiotics, I don't like the word treatment, but maybe intervention, or maybe amelioration or improvement of sleep, or alleviation of anxiety or depression or worrisome symptoms in these individuals is what I'd like to phrase this as, really. But there have been studies looking at prebiotics, which are the fibers and also beneficial microbes as well, that isn't achievable with a diverse diet. And again, it could be the development of the bowel, it could be the genetics that are driving the suboptimal microbiome. But in essence, anyway, we do see benefits by introducing prebiotics, the fibers and probiotics in individuals with autism spectrum disorder as well. So again, looking at obesity, which we now know is an enormous global health problem. And we tend to see this around the world, so not just in Ireland and across Europe as well, but of course it's a huge problem around the entire world as well. What we tend to see is increases in concomitant health problems. Then if we do see childhood obesity, we tend to see type 2 diabetes as children age, hypertension, dyslipidemia, fatty liver disease, also psychological problems as well, which often progress into adulthood. So we know, of course, and we've seen some studies to show that the microbiota within our bowel is associated with obesity as adults, but potentially now we're looking at whether this microbiota in early life, and we're looking at this in the APC, my colleague Harry Skellikens is looking at this particularly. Do factors in early life drive differences in the microbiome then to lead to certain individuals craving certain different types of foods that actually increase their risk for developing obesity? And this is really, I suppose, lifestyle factors that we really need to incorporate. So are there maternal factors? Are there stress factors? Are there, inbuilt scenarios that actually lead to a changed or altered or suboptimal microbiome in early life that is a risk factor then to lead to obesity and lead to a very disproportionate consumption of fatty foods, Western style foods, and really undesirable foods for our overall well-being and health. And also we know as well socioeconomic status is also a risk factor as well. So what we tend to see in children as well that do have childhood obesity is an increased ratio of the firmicutides to bacteroidetes, which now has been shown in some individuals to be a biomarker for obesity susceptibility. Some people say that it's not, but it has been for many years shown to be a risk factor. But again, it's not as simple as the actual ratio between firmicutides to bacteroidetes. So we do need to look at different communities as well. And there has been a lot of research ongoing in this, particularly in APC as well. So the contribution of microbiota to obesity is really multifactorial. What we do need to do is, I suppose, look at how supplying additional calories to the host is affected by the microbiota, because we know that our microbiota within our bowel is very good at energy harvesting. So maybe certain individuals have those bacteria that just take an awful lot of calories and process them for the individual. So different styles and different compositions of microbiota allow for us to harvest energy in a very different way from our foods as well. And also as well, our microbiota within our bowel is important for modulating blood lipopolysaccharide levels, favors fat storage, and affects satiety as well. And just, I suppose, as well, from the maternal point of view, I'll just pop us over there for a sec. From a maternal point of view as well, is that there could be this concept as well of transgenerational transfer. So what we tend to see is some individuals that are obese or have a higher BMI during pregnancy, we tend to see that because it may be a little bit more difficult, they might be less likely to breastfeed. And we do have seen before that breastfed babies are more slender and have a less body fat than those formula-fed babies. Now, there's different factors that lead into that as well. People that breastfeed tend to feed the baby, and the baby determines the off switch, or when you think your baby is full, then you stop breastfeed, you stop the breastfeeding session. But with formula feeding, usually you want to see a certain amount consumed from the bottle. So what tends to happen with formula feeding is, the mom wants to see the baby has consumed 200 mils, for example, while with breastfeeding, you just say, okay, it's done now. I'm happy enough to take a break and have my cup of tea. So maybe it's just less volume. There's still lots of different factors, but there is a link between less fat and being breastfed than formula fed. So maternal obesity as well also leads to a higher rate of C-section, which can also make breastfeeding a little bit more difficult because you're less mobile. You have this scar as well in your abdominal region. And then also as well, we've shown, or other studies have shown, that breast milk composition is actually different in C-section moms than vaginally delivered moms as well. Potentially as well, if we don't see breastfeeding, we have C-section, this is all going to have compounding factors on the actual infant gut colonization as well. So potentially there is this transgenerational transfer, potentially as well if the vaginal delivery occurs as well, the transfer of the actual vaginal and gut microbes transfers to the baby as well, potentially transferring obese phenotype through the actual microbes as well. So again, this was just a study looking at oral and gut microbiota associated with childhood obesity. I'm just checking the timer as well, because we want to have time for questions at the end, so I could speed up some of this as well. So this was just a really, really comprehensive study where they collected stools from normal weight children and also obese children as well. Probably they had to phrase that a little bit nicer to be ethically compliant as well. But what they did was they did a microbiome analysis and also a number of different clinical analysis on these two sets of individuals as well. And they did find that the individuals that had obesity, that there was a link between the oral and gut microbiome of these children, which were aged very, very young. They were 3 to 5 years of age as well. So indicating that there was already a link between the microbiome in very early life and developing obesity as well. So again, potentially further studies are necessary to look at the mechanisms associated with this. Probiotics in clinical trials remain limited because trials have mixed results. And again, maybe some of these interventions in early life, and we do see, especially up to 3 years of age, we see this dynamic shift in the microbiome as well. And again, some children are naturally a little bit heavier up to about 3. So looking before 3 years of age really isn't appropriate. Potentially after 3, we may see more. But again, this needs further investigation, and my colleagues are doing that as well. So we might just run through this very, very quickly. Atopic disease in children is very common. It's associated with altered immune system, but also certain studies as well have shown that an altered microbiome is also present as well. And we know that human milk oligosaccharides, which are present in their fibers within the actual, or their proteins within the actual breast milk, feed the beneficial microbes such as bifidobacteria. Bifidobacteria in early life are very good and beneficial for our immune system, development of our brain, and have been shown to be associated with decreasing immune profile and inflammatory profile for atopic disease. So I suppose just kind of wrapping up this concept of looking at maybe microbiome targeted interventions for childhood disease and brain health, there have been a number of studies looking at live biotherapeutics. These are probiotics, so these are live bacteria. What is maybe easier to produce, or maybe a little bit better to look at, is looking at diet first. So I'm a big believer of trying to change our diet as adults so that children will mirror this as well. So food first is a phrase of mine as well, is that maybe trying to change our diet first, but of course you can incorporate fibers and prebiotics into your diet for your brain health as well. Postbiotics are those metabolites that are produced by our probiotics, and of course as well, fecal microbial transplantation, potentially as a future alternative if we can't. Again, change the diet, change the microbiome with diet and prebiotics and postbiotics. Some of the other types of interventions that are being assessed in APC Microbiome Ireland are looking at different engineered type bacteria and also phage therapy as well. So with that, I'll just leave you with some take-home messages. Animal studies, which I didn't talk about much today, but they do continue to evolve. They are challenging, of course, in their own right. They do lend themselves to, I suppose, early concepts and proof of concept kind of design of interventions. This replication across cohorts is critical, but poses lots of logistical and material challenges as well. So trying to have this kind of cross, I suppose, collaboration where we all sit down, discuss the actual types of ways we collect materials and microbiome and information on the actual individuals and children's about brain and gut health is very, very important. So to standardize this across our studies, but looking at defining the directionality of cause and effect in large studies would be really provide unprecedented opportunities for generating hypotheses that can be tested in humans and experimental animals, and overall really to improve the health outcomes for children and brain health. So thank you so much for your time and listening. It was really my pleasure to be here.
Thank you so much for this great presentation, like always. Thank you so much. So I would like to ask the participants to just write their questions in the chat box. And I will start with one question. So I think that it's very common now to give probiotics to neonates, to infants. But do you think at some point that giving too many probiotics or some special types of strains might be harmful for the young baby?
Yeah, I think we still need actually to do an awful lot of research of what is appropriate in very early life. So some of those organisms actually have been isolated from adults. So that's potentially not beneficial for a baby to have an adult microbiome that has been shown to be very beneficial in adults. But introducing it in very early life, I don't think is absolutely necessary. There have been some definitive studies looking at, for example, Bifidobacteria infantis, which we know is very positive for the growth of babies' brains, particularly around the stress coping mechanism in babies. So introducing adult species, I would say, is not really a beneficial idea, but I would definitely introduce maybe more prebiotics. So those fibers such as galacto-oligosaccharide, fructo-oligosaccharide in early life to actually promote the baby's own beneficial microbes that actually reside there is a much more better alternative. So it's the same during pregnancy as well. We still don't have a very good, I suppose, profile during pregnancy, what happens to the maternal gut health as they actually go through pregnancy. So again, there are probiotics for pregnancy out there as well, but again, it's a delicate time, a vulnerable period during pregnancy because the maternal gut health can affect the baby. So introducing probiotics either in utero or in very early life neonatal period, I would say if we could do that using prebiotics and fibers, it would be a lot more beneficial. Not that probiotics are unsafe, but it's just we don't have the information on what is the optimal gut microbiome for babies. And also these haven't been tested in the long term either.
Yes, thank you. So we should be a bit more restrictive with giving too many probiotics to babies. So we have a question from Nevzat. Which factor plays the primary role in gut-brain communication? Consumed probiotics, host microbiota, or produce short-chain fatty acids? What about short-chain fatty acid supplementation?
Yeah, I think all of those play a major role. I don't think there's any one thing that stands out. They all, I think, is a combined factor, a combined set of those factors that really allow the communication between the end organs. But short chain fatty acids, absolutely. I mean, there have been some studies looking at, we'll say, for example, butyrate, high butyrate producing bacteria. And these have been shown to be beneficial, particularly with regard to pain and affecting the central nervous system from a pain perspective, potentially can reduce stressors as well. I know that there is ongoing studies as well looking at different combinations of short chain fatty acids and trying to introduce those. It is a difficult one as well to get that combination of the short chain fatty acids right as well, because some studies have shown, for example, if there's too much butyrate, you lead to, for example, an exacerbation of pain in certain individuals and an alteration in the central nervous system. So it's definitely a postbiotic that should be considered, but I suppose getting the combination right is critical. But I think postbiotics are a lot more convenient to produce and to actually have a longer shelf life than actual live biotherapeutics as well. And trying to get that much bacteria in to produce the amount of short chain fatty acids we need probably mightn't be viable a lot of the time. And a lot of those bacteria aren't viable as well and are not stable outside the bowel. So definitely moving towards short chain fatty acid intervention would be a really cool idea. Yeah. And it's ongoing.
And we have another question from Anne-Marie. Thank you for this great presentation. If anyone were interested in doing research on the microbiome, would you have some tips on potential areas of research and how they should go about it? Ethics are, as discussed, may be very challenging.
Yeah, it is challenging. It is challenging, but you just have to. I think, well, I can't not talk about women's health. So I think this is the place that people should work on. So women's health has been under researched and underfunded for forever. So I think this is the place that and there's loads of traction now. Money is starting, funding is starting to happen out for women's health. And it can happen, looking at, it doesn't have to be completely focused on women's health, but I think looking at sex differences between young children is very important as well. It is challenging, of course it is, but there are lots of ways and lots of experts around the world that you can draw on the expertise as well. And to be honest, collecting a fecal sample from a baby is probably the easiest thing you could do in the world. Mothers will hand you the dirty nappy, no problem. And actually, the bacteria within a lot of them they stay very stable either within the nappy, or there's also really fantastic tubes with solutions in there that keep everything stable. So when I started my studies as well, I suppose people were collecting large pieces of feces in boxes, and it was all very kind of antiquated at the time, and then they had to freeze it and bring this big box. But now there's lovely tubes and technology around the collection of samples that has just made more much more kind of patient friendly or participant friendly as well. But it also makes it microbiome research friendly, that they can just bring that in. It stays stable for about a few days or whatever at room temperature, and they can just bring it into the clinic then after that. And again, the prices of microbiome analysis has come down hugely, because now I think we can analyze up to over 300 samples on one plate, which brings the price down to about 30 or 40 euro. And then I suppose the next thing then as well is just to open a collaboration with a bioinformatician. So bioinformatics is key to microbiome research, but there's no need to try and do it yourself. Opening collaborations with bioinformaticians is possible as well. And again, within our centre as well, people are open to it as well. So while it's challenging, just chatting to people and getting just advice and technologies up there is starting to progress as well. So yeah, it's not impossible. And again, small numbers are fine as long as you standardise the protocols, as long as you standardise and try to have a homogeneous population as well. Biasing your study is okay. Choosing children that have a certain, score on a scale, for example, looking at that from a microbiome perspective is fine as well. So you do need to, I suppose, if you have smaller numbers, which we all do because of finances and so on, maybe bias your study with recruiting a certain population of individuals initially, unless we get enormous grants and we can survey enormous people and take microbiome samples from lots of people. But yeah, it's challenging but doable.
Thank you. And we have another question from Valentina Discepolo from Naples, Italy. Thanks for this comprehensive overview. Have you or other groups identified any biomolecule, either metabolite or bacterial component, that could be used in the near future for diagnostic prognosis and or therapeutic purposes more specifically, other than probiotics for multiple purposes?
So I think there's no specific microbe has been, I suppose, found. Like, sorry, when you see a study where only one microbe is found to be different between a population, people are very skeptical. A study was carried out in endometriosis. One particular bacteria was identified. But it's difficult because they live as communities. So what we tend to see is that kind of communities of bacteria are altered. But then I suppose, while that is useful for observational studies, designing an intervention around a community of bacteria is difficult. So we're still very much restricted when we design interventions. We're still restricted by what is a list of bacteria called GRAS, or generally regarded as safe. We're also restricted when it comes to shelf life, and also restricted. Some bacteria just won't grow outside the gut because of anaerobic lack of anaerobic conditions. So when we're designing interventions, we are very much restricted by safety, by actual logistics of growing and stabilizing them and scaling them up as well, and then also getting them to the right part of the bowel. So we kind of have to compromise. What we tend to see is communities of bacteria may be altered. From that, then we pick certain species then that we could potentially introduce into an intervention. Or else you might pick, one anti-inflammatory, one anti-stress, one bowel health bacteria, or one that's been shown to be beneficial for permeability. So whilst interventions are restricted by a certain element of logistics, we have made progress. So I've designed an intervention around women's health for the moment as well, and it's not. It is difficult to do, but it is possible to do as well. And it's to target brain health, really. So reducing stress, reducing brain fog, and also improving sleep as well. So it is possible to do it, but often we have to, I suppose, design it from the point of view of what is already out there and known about these specific stable species. But yeah, absolutely, we should design.
What is your opinion about using probiotics in autistic children from Madeira?
Yeah, super question. I would say yes, once they're past, maybe 3 or 5 years of age. Before that, I would introduce prebiotics, which are the fibers. So galactoligosaccharide has been shown to be very beneficial for promoting bifidobacteria, for example, which we know is very good for affecting brain health and having positive effects on brain health. After 5, then I think 5 years of age, if the child is diagnosed, I think introducing probiotics into the diet is absolutely beneficial. It'll have a beneficial effect on the immune system, potentially act as an adjunct to any therapies the children are on. And again, while specific bacteria or probiotics haven't been designed, as far as I know, for autism, but I'm not an expert, but those around, ameliorating the immune system. There's also some probiotics that have been shown to be effective in reducing infections in children that are on the market now as well. So probably a combination of probiotics past 5 is okay. Not one particular species. I think a combination of bacteria past 5 for autistic like kids would be super to introduce after 5 years of age. Before that, prebiotics such as fibers.
Thank you. Next question. What is the optimal duration for rectifying dysbiosis by an evidence-based standard dose probiotic supplement? When to switch to another one?
Maybe say that
again. So what would be the optimal duration for rectifying dysbiosis by an evidence-based standard dose probiotic supplement? And when should we switch to another one?
Okay. So you mean that if we start taking a probiotic and it's not working? Or which?
Well, just I think like maybe trying to recover the microbiome and then just change probiotics until the microbiome is good again.
I see. Yeah. That's good. I would say you should start to feel effects after about a week. But again, it depends on what people are consuming. So fibers such as galactose-oligosaccharide, when taken at about 5 grams a day, has positive effects with regard to actually changing the microbes in our bowel. So increases bifidobacteria after a week if we consume 5 grams a day for a week. And then it should have positive effects. But of course, when you remove that from your diet, it can go back to the dysbiotic gut as well. But I would say if you want to think about it from a diet and fiber perspective, I would definitely introduce different fibers and different yogurts with different bacteria in them. You don't even have to have a prescribed different type. You don't even have to say, well, I'm going to choose this yogurt with these bacteria and that bacteria. Just having a diverse diet should potentially bring the dysbiotic gut back. If you're not feeling well after about a week or 2 weeks on an optimal microbiome diet, then I would actually consume a commercial product that contains a variety of different probiotics on it. I won't mention any products here, but there is products on the market that would have maybe about, I don't think you need 14 different species, but there's up to about, maybe 5 different species that have been clinically validated. So this is what you want if you buy a commercial product. You want to have a product that has commercially validated on the back of it. Very few have, because you don't have to have that for a probiotic. But I would say maybe try diet for 2 weeks. If you don't feel well, then do try a probiotic supplementation that you can buy commercially as well. But continue taking the fibers within your diet, because you still have to feed the commercial ones that you're actually paying for. So you want to keep feeding those with your fibers to get your biggest value for money. So definitely fiber, increase fiber, take a commercial product after 2 weeks if the increase in fiber isn't helping.
Super great. So I think we are on to our last question. So from Yilmaz, have any gut-directed microbiome therapies such as fecal microbiota transplantation shown consistent benefit in disorders of the gut-brain interaction? And what are your thoughts on the use of probiotics in immunosuppressed patients?
Yeah, so no, FMT hasn't been shown to be effective, or it's definitely not been consistently used or shown to be effective for brain gut stuff yet. So no, that hasn't been shown yet. And potentially maybe the effect isn't powerful enough. I'm just not sure. Probiotics in immunocompromised people, I think we need to be extremely cautious there. Again, potentially looking and comparing them to babies or neonates as well. With immune compromised people, we do need to be very careful and take careful steps as well. So introducing probiotics that we know affect your immune system and produce a number of different immunological mediators probably isn't beneficial, or probably isn't the optimal thing to do unless it's been tested in immunocompromised individuals. And again, depending on what microbes are resident in these individuals' gut, they may react differently. So I don't think it is, for a severely compromised person, I definitely wouldn't do it. Again, prebiotics would be a much more better way to do things. Introducing your phos or GOS, your inulin, or your resistant starch or lactulose, or some one of the other fibers can be introduced really, really easily and quickly. And again, has the beneficial effects quite quickly on the beneficial microbes that are resident in the bowel of that individual, without the huge maybe bloom, because that can happen as well. If the actual individual is immunocompromised, they have a potentially different a suboptimal microbiota. So introducing probiotics might lead to this bloom of these probiotics and have an immune response that isn't beneficial for the time. But again, treading carefully initially with prebiotics would be better.
Super. Thank you so much for this great presentation. And I hope all of you enjoyed this webinar, and also I hope to see you soon to our next webinar next month. Thank you again, Siobhain, for this great webinar.
See you soon.
Thank you all. Thank you all.